Hey everybody, welcome back. So let's continue. How would a person-centered therapist, Rogerian therapist, treat ADHD, Attention-Deficit Hyperactivity Disorder? So a person-centered therapy counselor rooted in the work of Carl Rogers would approach ADHD from a deeply humanistic perspective. They would not focus on treating ADHD as a deficit or a disorder in the traditional sense, but rather on fostering the individual's inherent capacity for growth and self-actualization, regardless of their neurotype. The core of the approach would be the creation of a therapeutic environment characterized by the three core conditions: unconditional positive regard, empathy, and congruence. Here's how a person-centered therapist might speculate about and treat ADHD. Emphasizing the actualizing tendency, inherent drive. Rogers believed that all individuals possess an innate actualizing tendency, a fundamental drive towards growth, self-improvement, and reaching their full potential. For someone with ADHD, this tendency might be hampered by years of negative feedback, struggles with executive functions, and feelings of inadequacy. Focus on strengths. Rather than dwelling on symptoms or fixing what's wrong, the therapist would help the client recognize and build upon their unique strengths, which are often associated with ADHD. For example, creativity, spontaneity, passion, ability to hyperfocus on interests, and innovative thinking. 2. Providing the core conditions. Unconditional positive regard. This is paramount. The therapist would offer complete acceptance and non-judgment regardless of the client's behaviors, thoughts, or struggles related to ADHD. For a client who frequently forgets appointments, interrupts, or struggles with organization, the therapist would respond with understanding and acceptance rather than frustration or criticism. This helps counteract the lifetime of negative feedback and shame that many individuals with ADHD experience, fostering a sense of inherent worth. Empathy. The therapist would strive to deeply understand the client's subjective experience of living with ADHD, walking in their shoes. It sounds incredibly frustrating to have so many ideas but feel unable to organize them. I hear how lonely it feels when you feel misunderstood because your brain works differently. The therapist would reflect back the client's feelings and meanings, validating their internal world without imposing interpretations. And congruence, or genuineness. The therapist would be authentic and transparent in the relationship, modeling realness and honesty. This builds trust and provides a safe space for the client to be their authentic self, including their ADHD traits, without fear of judgment. 3. Fostering self-acceptance and self-concept. Reducing incongruence. Rogers theorized that psychological distress arises from incongruence, a discrepancy between one's self-concept, how one sees oneself, and one's actual experience or ideal self. For individuals with ADHD, their self-concept may be heavily influenced by negative societal messages and personal struggles, leading to a belief of being broken or less than. Integrating ADHD into self-concept. The therapist would facilitate a process where the client can openly explore their experiences with ADHD, ultimately integrating it into a more positive and realistic self-concept. The goal is to move towards self-acceptance. This is part of who I am, and I am still a valuable and capable person. An internal locus of evaluation. The therapist would help the client shift from relying on external validation or criticism to an internal locus of evaluation, trusting their own feelings and judgments about what is right for them. The non-directive approach. Client is expert. The therapist would view the client as the expert on their own experience of ADHD. They would not offer specific solutions or techniques for managing symptoms in the way a CBT therapist might. Instead, they would trust that given the right supportive environment, the client will naturally move towards solutions that work for them. Exploring challenges from the client's perspective. If the client expresses frustration with disorganization, the therapist might reflect, "You're feeling overwhelmed by the clutter. What does that feel like for you right now?" Rather than suggesting a filing system. The implicit assumption is that through deep self-exploration and acceptance, the client will identify their own needs and solutions. Pace and flexibility. A person-centered therapist would be highly attuned to the client's pace and needs. For someone with ADHD, this might mean allowing for shifts in conversation, understanding that attention might wander, being patient with apparent lack of progress on practical tasks, focusing instead on the client's emotional processing, and not imposing rigid structures, but rather following the client's lead. Limitations and complementary role. While person-centered therapy is incredibly powerful for fostering self-esteem, self-acceptance, and emotional processing, it has limitations when it comes to directly addressing the functional impairments of ADHD. Not a skill-building therapy. It doesn't teach concrete strategies for time management, organization, or impulse control, which are often crucial for managing ADHD symptoms effectively in daily life. Less directive. Its non-directive nature means the clients who are looking for clear, actionable steps might find it less immediately practical for symptom management. Therefore, a person-centered approach to ADHD would likely be most beneficial as a complementary therapy, especially in conjunction with other interventions like medication, executive function coaching, or CBT. It could provide a foundational space for emotional healing, building self-worth, and coming to terms with the personal impact of ADHD, which can then enhance the effectiveness of more skill-based therapies. It would not focus on the individual's journey of becoming a highly and coming to terms with the personal impact of ADHD, which can then enhance the effectiveness of more skill-based therapies. It would focus on the individual's journey of becoming a fully functional person with ADHD, rather than seeing ADHD as something that needs to be cured or eliminated. I hope you found this useful. What do you think? What do you think about the approach of using person-centered therapy with ADHD? Would this be the approach you would choose? Let me know in the comments, and I'll speak to you next time. Bye-bye.